With us today is Dr. Tariq Hakki with Atlanta Cosmetic Urology. Welcome, doctor. Thanks for joining us. Right off the bat, give us a little bit about your background and also why urology?
Thank you. So my name is Dr. Tariq Hakki, and I'm a urologist here in the Atlanta metro area. Why urology? My father was a urologist, and my familiarity with it and my desire to follow in his footsteps really drove my passion for this. I also am very interested in men's health and sexual health, and so that's another driving factor for me to go into urology itself.
Excellent. So where did you study? Where did you start off at?
Great question. So I started my medical education at Florida State, and I got my medical degree from FSU. Afterwards, I then went to the University of South Florida, where I got my general urology training. It was there that I got exposed to some men's health and work in sexual health under Dr. Raphael Carrion. From there, I then did a fellowship in Houston at Baylor.
Okay, so a fellowship. Tell me, what does a fellowship mean? What does that do?
So a fellowship is after you completed your regular training to be a physician through residency, you then complete a 1 to 2 year subspecialty training, and that's called a fellowship. And only around 1 to 3% of your urologists actually pursue fellowship training. And this allows you to hyper-focus or super specialize in one area of urology. And for me, I went to Baylor to train under Dr. Lipschultz to learn about infertility, andrology, and sexual health. So that gave me extra training to be able to do more for patients.
So Dr. Hakki, what do you want me and future patients to know about you?
Matt, that's a great question. I want patients to know that I'm a general urologist and I focus in sexual health. So I can treat men that have erectile dysfunction, have penile curve or Peyronie's disease, have low testosterone or hormone replacement therapy and weight loss therapies, also enlarged prostate, circumcision, vasectomy, or reversal, and other homeopathic and alternative medicine approaches.
Okay. So why did you start Atlanta Cosmetic Urology? Because you are the director there, correct?
Yeah, I'm the director of Atlanta Cosmetic Urology, and I started Atlanta Cosmetic Urology because I want to help restore and rejuvenate sexual health needs of my clientele, and I want to offer a boutique practice to patients to offer for them ways that we can use regular medicine and alternative complementary medicine to integrate and customize and specialize their care for their sexual needs.
Tell me a little bit about erectile dysfunction and some other things that you said you specialized in. So let's unpack erectile dysfunction.
Great question, Matt. So erectile dysfunction is the inability to get or maintain an erection, right? And 1 in 4 men over the age of 50 suffer from erectile dysfunction. And many of the causes of erectile dysfunction are things that happen to men as they age. So causes of erectile dysfunction can be high blood pressure, can be from diabetes, can be from high cholesterol. And these are some of the reasons that you go see your primary care doctor.
What are some treatments for ED?
So some of the treatments, we like to start with, diet modifications and also exercise. So diet and exercise are really important as far as preventative care goes, and also making sure that you stop and further the progression of the erectile dysfunction. So we start there with having patients, try to change what they're eating. From there, we go into pharmacological agents, such as pills of sildenafil, tadalafil, which are the Viagra and the Cialis.
Okay.
And these are pills that are taken generally before intercourse. These have side effects. Generally, if the pills don't work, we have patients then look towards other therapies such as Muse, which is where you use jelly and you inject that into the urethra or the tube that you urinate through. And that causes and induces a pharmacologic erection. This can cause some burning, but it induces a local pharmacologic erection instead of taking a generalized pill, which can cause headache, amongst other things.
Okay.
Other alternatives are injection therapies. Injection therapy is where you inject pharmacological agents into the penis itself, which induces an erection. Okay. This is the strongest pharmacologic erection that we can naturally induce.
So what is a penile implant?
That's a great question. So a penile implant is a self-contained medical device that's inserted inside the penis that causes an erection.
Okay, so how does a penile implant work?
So there are generally 2 types of penile implants. There's the semi-rigid penile implant, which is hard all the time, and it's bent up and down to use. And there's the inflatable penile implant, which is flaccid in most of the time, and then when intercourse or relationship is desired, you pump up the device and then it becomes erect. And then when you're done, you can deflate the device. And that's the inflatable or the 3-piece penile prosthesis.
What is a penile implant?
Matt, that's a great question. So a penile implant is a mechanical device that's inserted inside the penis that allows a man to get an erection, and it will not change orgasm or ejaculation.
So how does a penile implant work?
So the penile implant, there are two different types of penile implants that are available on the market right now. So there's a semi-rigid penile implant, which is hard all the time, and the patient bends the device up and down when they would like to use it. There's also the inflatable penile implant, which has got three parts or three pieces to it. So the three-piece penile implant inflates and deflates whenever the patient desires to use the device.
Okay. So it sounds like you work with implants quite a bit. Is that common in your practice?
Yeah, I do a lot of penile prosthesis, and I'm a Coloplast Center of Excellence.
So so a Coloplast Center of Excellence, what does that mean?
So in order to be designated as a Center of Excellence, you have to perform over a certain number of penile prosthesis a year. Each year, you must do over 30 implants. So as long as you're a high-volume implanter, you're able to be designated as a Center of Excellence. And not everybody is able to be labeled as a Center of Excellence. So I am the Center of Excellence for Atlanta.
So you truly are an expert in this field.
Exactly. Because I have a lot of experience and I have the fellowship training, allows me to perform one of the top-notch penile implant surgeries on patients. I usually do a minimally invasive approach. Roughly half-inch incision in the scrotum is made, and the implant is inserted through this.
So I hear a lot about low testosterone or low T. What are some symptoms of this, and how would I know that I'm suffering from it?
So a lot of men experience low energy, low libido, loss of muscle, gain of fat, depression. These are all common symptoms for testosterone that is low. And in general, if you go in to see your physician, you can have your blood drawn before 1 o'clock, and we can see if your levels are below 300 nanograms per deciliter, which is our line and cutoff for low testosterone.
So how would you treat low testosterone?
How do you treat low testosterone is a great question. So testosterone is lowered by weight gain and by other habits that we have that we try to reverse, such as diet and exercise. I also like to give patients hormone replacement therapy in the form of testosterone shots. There are also creams that are available. There are pellets that are inserted under the skin. There's inhalable testosterone, and there are even oral forms of testosterone and patches that we can give patients as well. In general, when you look at testosterone replacement therapy and hormone replacement therapy, you can give somebody an anabolic testosterone, or you can switch to natural therapies, such as HCG and Clomid. And these are ways of raising testosterone naturally.
So you talked about some areas that you specialize in. Vasectomy is one of these areas that you have a specialty in. What is a vasectomy?
Vasectomy is where you tie off a segment of the vas deferens that drains the testicles. This blocks sperm from leaving the testicle itself, rendering a man sterile.
Okay. Now, if that is a very scary sound to say vasectomy, I've heard of a no-scalpel vasectomy. What is that? Could you explain that to me?
Yeah, so essentially what we do is you make a small puncture in the skin, and then you grab the vas deferens through a single puncture hole without using a knife. I also do a no-scalpel and a no-needle vasectomy. So patients are generally given a light sedation. They come in, and we use a pneumatic device to cause anesthesia, local numbing to the skin, and then we just make a small puncture in the skin, and the patient goes home the same day.
So what is the recovery time of a vasectomy?
In general, it's 3 days. Patients usually complain of soreness for that amount of time.
And how are the results verified?
So after you performed a vasectomy, you need to perform a test to make sure that there are no more sperms in the system in the vas deferens from downstream from where the vas was clipped.
Okay. So we talked about having a vasectomy, but if we want that reversed, how does that work? A reverse vasectomy, is that what you call it?
Vasectomy reversal, it's not a common procedure, and most urologists do not perform it. I'm fellowship trained in vas reversal, and I can perform both the vasovasostomy, which is where you tie the two ends of the vas back together again, and the more complex epididymovasostomy, which is where you tie the vas back into the back of the epididymis, or the back of the testicle itself.
Why would I consider a reverse vasectomy?
So if you have a situation that you would like to have more children, especially more than one, undergoing a vasectomy reversal is more cost-effective, and it's a simple, easy procedure.
So what is the success rate of a reverse vasectomy?
So the success rate of a vasectomy reversal is generally in line with how long it's been since your vasectomy. So all comers, it's around 78%. But if you do a vasectomy 1 year after undergoing, or if you do a vasectomy reversal 1 year after undergoing vasectomy, the success rate's 97%. But that number starts drifting downwards as the years go on.
So I've heard about BPH. What is BPH?
So BPH stands for benign prostatic hyperplasia, and this basically is enlargement of the prostate.
Okay.
And so as you get older, your prostate tends to grow in size, and it can grow on the outside, but it can also grow on the inside, and that can affect your flow rate. So many men that have BPH have low flow, weak stream, dribbling, trouble starting their flow and trouble stopping their flow.
And so what are the treatment options for the enlarged prostate?
So treatment options for enlarged prostate include pill therapies, and then also Urolift, which is a therapy where you staple the prostate open, and also Resume therapy where you steam the prostate, and aqua ablation and transurethral resection of the prostate, where you essentially roto-rooter the inside out.
Okay, interesting. All right. So I want to touch base on circumcision. Will you tell me a little bit about it and maybe some benefits of being circumcised?
Great. So circumcision is where you take a portion of the foreskin and you remove it. Most men that undergo circumcision do it as a child. However, issues may arise where you need to be circumcised as an adult. I like to perform circumcision on men and perform what's called a high and tight circumcision if they'd like to maintain the foreskin area, because that's a very sensitive area of a man.
Okay, so what are some issues with being uncircumcised?
So issues with being uncircumcised is it increases your risk of penile cancer, and also you can also have increased risk of transmission of HIV if you are HIV positive to your partner because there's skin there. You can also have issues, your partner can have issues with transmission of urinary tract infections and bacteria, especially if the skin is not kept clean.
Is there an age limit to being circumcised?
There is no age limit to being circumcised. However, there is an age limit to getting the benefits of circumcision. So studies have consistently shown that men that are circumcised before they go through puberty overall have a decreased risk of contracting penile cancer throughout their life.
And what is the recovery time of being circumcised?
Roughly 2 to 3 weeks. It just depends on the patient and how sensitive that area is and how much work needs to be done.
So tell me a little bit about penile curve.
So penile curve can happen either when you're born with it, called congenital chordee, which means you've always had a curve, and this can occur up, down, left, right. And also you can develop a new onset curve. So new onset curve is called Peyronie's disease. And Peyronie's disease is usually associated hand in hand with erectile dysfunction. So if you had a straight erection and you developed a penile curve, that would be Peyronie's disease.
So what causes Peyronie's disease?
Peyronie's disease is caused by microfractures to the erectile bodies. During penetration, if a penis is not completely hard, then you can develop bending and buckling, and those microfractures cause scar tissue. And over time, that scar tissue can cause curve.
So how are you able to treat Peyronie's disease?
So Peyronie's disease is generally treated with medical therapy in the form of Xiaflex, and also surgical therapies in the forms of dot plication, patch grafting, and penile prosthesis.
Now let's talk about hormone replacement therapy. You mentioned this earlier. Tell me a little bit why I would be a candidate for it or who would be a candidate for this.
So many folks that come in that have low desire, that have muscle loss, have weight gain, have depression, and lower libido are candidates for hormone replacement therapy.
Dr. Hakki, it is apparent you are very passionate about this subject. Any final words that you would like to leave us with?
Yeah, so thank you for having me here. I'm very interested in and passionate about men's health and sexual health. And I want to help patients rejuvenate, restore, and improve their overall sexual health and well-being. And I'm positive that if you come see us, we can gladly integrate and customize a healthcare need for you to make sure we improve your sexual health. Okay.